RPHL community to join our online marketplace. I think today the topic itself is very important. So we want to also, before we proceed, we also would like to get a snapshot of your picture. We would like to kindly asking all of you to turn on your camera if it's possible, right? If it's possible. Okay. So then our communication officer will take a snapshot. And of course, we will have the second round and waiting for a few more people to come. Registration today, we receive almost 100. And we also have also colleagues joining us in this meeting room as well. So is this done? Lina, done? 1, 2, 3, go. Thank you. All right, so thank you very much. We will have another round after we, maybe after we done the second half of our marketplace today. So the marketplace of RPHL, can I have my slide please? The marketplace of RPHL, the intention of RPHL for having this kind of online marketplace, because we understand that now everyone go for online shopping, right? So RPHL as well, we also want to promote online shopping as well. So in doing so, we also align with our three-pronged approach for capacity building. Number one is that we want to provide technical assistance, peer-to-peer support, motivating each other as well as the buddy system. So this is the first approach. Second approach, we also conducted training, but we focus on trainings of trainers because we would like to have the a bigger pool of subject matter of expert in different area. Third one is that we also would like to encourage and knowledge sharing among RPHL network members and communities. So this is a free platform, and then we try to engage and reach out more of our community too. So with this three-pronged approach of RPHL on capacity building, we expect and we wish that we will have the resilience regional community on the laboratory system. So that's what our wish, So next slide, please. And today is also just to mention to you that when I'm saying that we want to grow more of a pool of the subject matter of expert. Here is what we are, what we have so far. We have a group of subject matter of expert for quality management system, right? We also have a group of biorisk management, and the Global Laboratory Leadership Program, or GLLP. We also have a group of subject matter of experts who can support you when you want to develop your national laboratory strategic planning. Last but not least, when we're talking about this online marketplace today, we also want to very pleased to share with you that we will have the subject matter of expert on the disposal waste management. So how did we do that for the disposal waste management? Can I have the next slide? So I already mentioned that for this particular session, you will, our trainer will share their experience, will demonstrate their capability to become the subject matter of expert on disposal waste management, both at their own country and for RPHL Network as well, right? So next slide. So why the waste management itself has become an issue and key priority for RPHL Network. I think all of you might agree with me that during the COVID-19, this is one of the most challenges that RPHL Network members have faced. And until now, some countries be able to solve based on the lesson learned from COVID-19, but some still is under progressing their work. Right? And to doing this activity, training of trainer, we work together with the DETRA, who has been long-term partners since the RPHL has been established. A very prominent partner with DETRA. And DETRA has Sandia National Lab, tasking Sandia National Laboratories to support RPHL in training the trainers, in training the trainers. This is the first, it was the first cohort. So then this is kind of pilot to us too. So then we said that let's focus on those few countries first. So we selected participants from Thailand, Malaysia, Laos, PDR, and Cambodia to attend this intensive course, intensive course with the 3 phases, 3 phases. Can I have next slide? So we have 3 phases. Phase number 1 in last year, in early of December. So we conducted the workshop, the training workshop, and I also want to highlight and share my my experience during my observation of this workshop is that the trainer themselves from Sandia National Lab is very experienced. And what we highlight during the workshop is also focusing on adult learning theory, right? So we conduct the 4 days workshop with 1 day of trying to teach back or to conduct the training. But we also have the virtual orientation for our participants as well. So then few more months, we let them digest, and then we invite them to attend also phase number 2, whereby we will be able to conduct a teach back session at the as a side event for the RPHL Network annual partnership forum in Siem Reap, right? In Siem Reap. And during the phase, from phase 1 to until phase number 3 here, I also want to highlight that virtual support, constant virtual support from Sandia National Lab has factored in the successful of the this course and try to coach, individual of the trainer to deliver the training in their own country, which is situated in the phase number 3, right? So after the February 1, so those participants, those trainees from the first cohort went back to their country, and I was told that they localized the curriculum and try to conduct the training in their own language, in their own language, of course, with the the experience that they gain from the workshop. So this is the model of RPHL that we are trying to nurture the trainer, the master trainer, to become our lab expert in many fields of the laboratory system, right? Laboratory system, and it's considered to be the good model for RPHL network as well. So next slide. So after this is to show you how active they are, during the three phases. We recently also I had opportunity to also attend the localized training in Khon Kaen, northeastern part of Thailand as well. So and that was great. That was great to see the way that they also adapt the technical to their own context, yeah, to their own context. The first picture you see that the Thai master, the two Thai master trainers, right? And they will share their experience more in their presentation. So next slide. And this is the atmosphere during the annual partnership forum. They also had opportunity to join the session of annual partnership forum and share their lesson learned in the in their this subject matter as well. So next slide. So for the next, I think 45 minutes to 1 hour, I won't be able to moderate the session by myself, but I would like to invite Ms. Renee Holland. She is the project lead engineering program, and you can count on her because with the 23 years of experience at Sandia National Lab, New Mexico, US, yeah, that already proved that how experience that she has and to support RPHL to coming up with a very qualified subject matter of expert. You see also the variety of country experiences also bring in to her experience to deliver the course, taking the context of the region and context of the country as well. I would also acknowledge that she been, working constantly to also support all of the participants to make sure that they go in the right direction and anything that they need immediate support. So Renee would be the one who do that. So I'm sure that today the sharing session is going to be great with the excellent moderator, Ma'am Renee Holland. So Renee, I like to give the floor to you, and 45 to 1 hour will be your time. And after your session, then we also have a good news to inform our community for the next phase of this important TOT as well. So Renee, please give the floor to you. Thank you for your time being with us today.
All right, well, thank you, Gentana. So good evening, everyone, or I should say good morning, depending on where you are in the world. It's the evening here in the United States. So I am Renee Holland, as Gentana has introduced me. So I'm from Sandia National Labs, the Global Chemical and Biological Security Program, and I do serve as the Sandia's project lead for the Indo-Pacific region. So it has been my pleasure to work with Gentana and the RPHL Network over the past 3 years. So tonight, or this morning for you all, I would like to start by thanking our sponsorship from DITRA's Cooperative Threat Reduction Program. They've afforded us the ability to coordinate the biological waste disposal, training of trainers, and building of these subject matter experts. And so we do appreciate their support. So I am pleased to see everyone on the call this evening, and I'm hoping I had a chance to interact with some of you all at the RPHL Network Forum. We have outstanding speakers, our trainers, who will be sharing their experience this morning, and I'm very proud of this first cohort of RPHL Biological Waste Disposal trainers. I guess first I'd like to thank everybody for taking the time and joining in today. The BRM Biowaste Management Training and Trainer Development is crucial to the region and global health welfare, and has never been more important than it is right now. So it's an honor for me to welcome you to this evening's marketplace. I'm very excited to have our guest speakers. Our first guest speaker will be Dr. Noor Ilham, and she's part of the Malaysia team. When we first started with the training of trainers for this first cohort, we had 11 trainers, and they conducted their first 2 trainings in Siem Reap. So we got our first 23 participants trained. From there, the Malaysia team, Cambodia, Laos, and Thailand have given an additional, thank you, Goy, 6 local trainings. And so I really love this infographic because it just shows that since December of last year, it hasn't even been a year, we have trained 177 total participants. I shouldn't say we, the RPHL Network new trainers that you'll have an opportunity to be introduced today have done all this exceptional work after their first trainer development program starting last December. So very proud of this work and very proud of the individuals. And so we are looking forward to the continuous support and commitment that this engagement enriches. We hope to continue to build and strengthen the virus management training program throughout the RPHL member countries. So very, very much so looking forward to cohort number 2 and gathering up your nominations and hoping to kick off the next cohort by August. So I want to thank the fantastic leadership for RPHL. Thank you, Gintana and her team, as well as our dedicated sponsors from DITRA for making this partnership a real reality. And once again, without further ado, have the honor of introducing our subject matter experts. And so our first presenter of this evening is Dr. Ilham. So thank you so much. Great to see you again.
Thank you, Ms. Chairperson and Ms. Renee. So can we have my slides? Hi, Assalamualaikum. Very good morning and also very good evening to everyone. I'm Dr. Noor Ilham binti Ahmad, a representative from Malaysia team, and I'll be sharing our experience in conducting a course on biological waste management, disposal management in Malaysia. Next slide, please. Okay, for Malaysia team is made up of 3 members. Me, Dr. Noor Ilham, pathologist from Johor Bahru Regional Public Health Lab. Dr. Noor Hafizan binti Mak Saleh, public health specialist from Kota Baru Public Health Lab. And Miss Suhaili binti Suhaimi, an engineer from National Public Health Lab, Sungai Buloh, Selangor, Malaysia. Next slide, please. So my outline of presentation today, I'll start with an introduction, objective of the programs, our biological waste disposal training, teach-back session in Malaysia, training activities and evaluations, learning outcomes, benefit of the training summary, and the conclusion of overall course. So it's all started on December 2nd to 4th, 2024, when the RPHL Network Biological Waste Disposal the trainers course was held in Bangkok, Thailand. This course was organized by the Sandia National Lab and supported by DITRA. And the purpose of this program is to develop a sustainable biological waste management training program for the Indo-Pacific Region Public Health Lab Network. This program involves 4 Asian countries, including Malaysia, Thailand, Laos, and Cambodia, and total of 10 participants from these 4 countries. The second training was held in Siem Reap, Cambodia on February 14, 2025, where participants from 4 Asian countries were divided into 2 groups and tasked with conducting training session for participants from Cambodia. Next slide. So objective of the program is to enhance the capacity of the trainers in biological waste disposal management, to review the principles of learning by design using the AD model and the practice of brain-based training strategies, which are designed to enhance sustainability of desired actions and behavior related to biorisk management, to enhance adult learning skills and knowledge, and to apply brain-friendly training techniques and integrate training style that are aligned with the content, curriculum goals, and desired outcome. To practice content delivery using effective training strategies. Okay, next slide. So for our teach back session in Malaysia, as for the Malaysia team, we conducted a biological waste disposal management training session, which start from May 13 to May 14, 2025, held in the Kota Baru Public Health Lab. The course was attended by 19 participants from across Malaysia, consisting of medical lab technologists, scientific officers, and state coordinators. The training activities last about 1.5 days, starting at 9 a.m. Next slide, please. Starting at 9 a.m. Next slide, please. Can I have my next slide, please?
Hang on a second.
Okay. Okay, for the
Okay, can
training.
you?
No, previous slide, please. Okay, thank you. For the training activities, it lasts about 1.5 days, starting at 9 a.m. with the opening session, followed by the first session titled Biological Waste Disposal, Objective and Experience by Dr. Hafizan. And then we have short break at 10:30 and followed by second session on regulation and guidelines of clinical waste management in Malaysia by Dr. Hafizan at 10:45. And at 2 o'clock, the third session on biological waste disposal steps in waste management was given by Ms. Hailey. And for the second day, we start at 9:30 a.m. We review back all the topics that we have covered the day before. And my first session start at 10 a.m. with the topic of the waste disposal, decontamination, treatment, and disposals. And my second session on 11, which entitled of decontamination, objective, and expectation, efficacy factors, hazards, and limitations. Okay, next slide. During the course, the participants were divided into 4 groups, each consisting of 5 members, and all the participants were required to actively engage in all the group activities. A short lecture was given related to the topics, and all the groups were required to carry out group activities such as listing the type of biological waste generated in their respective organizations. Next slide, please. Outlining the step in waste management, identifying proper disposal methods. Next slide, please. And selecting a representative from each group to present their findings on behalf of their groups. Next slide, please. We also engage in interactive sessions with all the participants. Okay, next slide. So after the training session, the evaluation, we found that 96% of the participants agreed that the course they attended were beneficial for them, while 96% also agreed that the course improve their knowledge related to the subjects. Furthermore, 95% of the participants also agreed that the course could enhance their competencies, and 95% felt more confident in carrying out the tasks assigned to them. Meanwhile, 93.5% of participants are confident in their ability to improve their department performance. Among the participant feedbacks and suggestions we received are as follows. First is to add more case study in the training program. Second, the training was delivered in a way that is easy to understand and effective. This is one of the feedback from the participants. And a suggestion from them is to further expand to all Ministry of Health staff and increase the frequency of the training session that are to be held. Okay, next session, please. So the learning outcomes at the end of the training, participants are able to identify the biological waste produced in their clinical setting and apply appropriate management practice. Familiar with the local guidelines and standards for handling and disposal of biological waste, they're able to apply safe practice to minimize the risk with the biological waste, able to participate effectively in group activities and discussion related to the biological waste management, and able to prepare to train peers and new staff on biological waste disposal. Although legal requirements vary according to the locations, the basic principle of biological waste disposal and treatment remain the same due to the risks associated with each waste type. Next slide, please. So benefit of the training, well-trained lab personnel are better equipped to manage biological waste safely, effectively, thereby reducing risk to themselves and to others. Next slide, please. So for the summary, the importance of biological waste management is to protect health workers from dangerous pathogens, to protect the community, to protect the environment, as well as to save the cost or reduce expenses for disposals. And next slide, please. The conclusion is biological waste disposal training is essential to ensure proper management of biological waste and compliance with regulations. To ensure the training was effective, met its objective, and provided a meaningful and engaging learning experience, various strategies were employed, such as incorporating brain-friendly approaches and utilizing adult learning principles. Improper disposal of biological waste can result in the spread of infectious disease, environmental pollution, additional health risks, and higher operational costs. That's all from me, from Malaysia team. Next slide, please. This is our reference, and thank you. Terima kasih.
Great job, Dr. Ilham. I think we have time for one question from the audience. If anybody would like to come off mute or put a question in the chat, you're more than welcome to do so. I think that was a great experience, that sharing that you just gave us. So really appreciate all the photos and pictures of the activities. And while we're perhaps waiting for a question to come in, could you maybe...
This is Dr. Kanchit. May I?
Yes, Dr. Kanchit, please. What
Thank
is your
you.
question?
First of all, congratulations to Malaysia team for this successful first in-country training course, and also congratulate to RPHL for the successful at least 3 phases, and you have demonstrated that you have alive to the outcome. My question to Malaysia is first, how much of the content that you learn from your training for trainer to be used in your in-country program? And secondly, how do you recruit the participants what is the criteria of to include participants in your course, in your in-country course? Thank you.
Thank you, Mr. Kamchit from Thailand. Okay, for the first questions, the content from the module that we have taken from the Global Biorisk management curriculum, and as well as from our local guidelines. Actually, from this course, we aligned these both two guidelines together, the standard guideline and local guidelines, so that it can be applied to all the health staff in Malaysia. So far, we able to utilize all the guidelines very well. And for the second question, how we recruit our staff, actually for this first time, for the first training we conducted in Malaysia, we invited all the medical staff, especially from the lab, all over the state in Malaysia. So we recruit them and propose to do one training to train or to give an idea to all the medical staff on how to conduct a good biological risk management, disposal management. So far, the feedback that we have received is all the from the states, they are willing to come and join our program, and they request us to do the training more regularly in this next year. In this, I mean the next time. So we plan in our planning, we plan to make this training program more regularly throughout this year and maybe next year.
Thank you. To follow up, for the experience on your first training,
Yes.
what is the optimum number of participants that you think you can handle for each course?
Okay, for the first training, we can't get too much participant in view of limitation in terms of the venue, the place, the budgets from the National Public Health Lab. So in view of we only having a small budgets and only 3 trainers, we managed to conduct the training only for 19 to 20 participants. Okay, for the first trainings. So it's just I think the number is just nice so that all of us can give our full training during the session. If the crowd or the participant is too many, we afraid that we might not able to deliver the module so well to the participants, I mean. So that's why the number of 19 to 20 is just nice for us to control the training program.
Thank you.
Welcome.
All right, thank you very much for that question. I also see a question in the chat. And so I happened to see that one of our master trainers from Sandia National Labs was on the line. So I'm going to put Eric Cook on the spot. And Eric, could you explain briefly what brain-friendly training programs is? What is the definition? What is that all about?
So what we mean by brain-friendly is making it using particular adult learning theory pedagogy that and learning activities that have been shown to be effective in helping enhance memory, helping enhance ultimately we want to change people's behaviors. So it's not just teaching them about risk, teaching them about waste management practices, but changing their behavior. And so the brain-friendly techniques that we have incorporated into the training design, but we also teach in the workshop how to use these activities to help participants learn, and not just to learn, but remember, and then also feel a desire to change their behavior. And that's what we mean by brain friendly. Thank you.
All right, thank you, Eric, for that. Well, it's my pleasure to introduce our next subject matter expert. We have a wonderful team from Cambodia that joined us in our first cohort of training. And while Mr. Smee is not available today, he has one of his peers, Sophia, is available, and he will be kind of discussing the experience from Cambodia. And so it's my pleasure to introduce Sophia. Sophia is part of the National Institute of Public Health laboratory system in Cambodia. He actually supports the quality management team and the ISO 15189 auditing and practices. So he works as the ISO consultant and quality manager, and he was a great trainer as well. So Sophia, please join us.
Thank you, Randy. First of all, good morning, good evening, good afternoon, based on your location right now. And Sophia, as the Randy have introduced me to everyone. Please interrupt me if you cannot hear me well, because due to my health condition for today is not really well. Yeah. Um, Next slide, please. According to our team, we have assigned to join the biological vet training in Bangkok for like three person from our institute. First is Mr. Kimbo Resme, who is responsible for safety in our institute, and me, Supir, responsible for ISO 15189 team lead for OPD lab in my institute, and the other is Mr. Yusum Pierce. He is the lab technician and responsible for safety in microbiology lab. Yep. For my content for today's presentation is I've just see in this slide, so I'm gonna make it through. Yeah. So next, please. Move to our introduction. In December 2024, we have joined the RPHL Network Biological Waste Disposal Training in Bangkok, Thailand, and which is they have joined with other countries such as Thailand, Malaysia, Cambodia, and Laos PDR, and was organized by Sendia Lab through by supporting from DITRA. And the goal of this program is to develop and sustainable waste management training program for Indo-Pacific region for public health laboratory network. And the proper biological waste disposal is very essential for human environment, which impact to our public health. Yes. Next, please. For the objective of the program is to strengthen the trainer capacity in biological waste disposal and apply a DDIE model, analyze, design, develop, implement, and evaluate for effective training design, and enhance adult training skill and integrated brand-friendly training technique, participating delivery method for impactful knowledge transfer. This objective I ensure will have equipped to train other effectively. Yeah. Next, please. For the this training, we got for the key learning category is to categorize all the biological waste and biological waste management process, such as segregation, collection, storage, transport, treatment, disposal, and also integrate with the adult learning concept, develop of the material for effective training, and demonstrate training method. And the activity during the training, we have formed our team daily, perform group discussion on biological waste, and we can take the stake for the experience sharing among the master trainer and the trainer, and also participate in our learning method and develop training material and teachback session as well at the same time. Next, please. For the learning outcome, I have divided into two parts, one for the trainer and another one is for participant. For the trainer is about to train and demonstrate the uh, training method, improve in effective communication capacity, enhance capacity on working in team, practice to deliver knowledge to trainees, and practice to the technique of framing the participants, which is very important during the training, and creation scenario for the training objective, and also create good learning environment. For all of this is to frame the trainer uh, to meet with what we want them to learn about and to gain the experience from them, such as the way that they share the experience, that the way that they like express themselves, and without all of this is without no any judgment, which is right or wrong, but we try to share and we gain the knowledge from each other. And next, please. For the participant, this is the learning outcome, and the participant will can like to define the biological waste and classify the different type, and identify regularly standards and guidelines, change in attitude behavior in managing biological waste by promote and safety culture, assess the waste management situation, identify non-compliant or potential safety branches, and prepare to train peer or new staff on biological waste disposal procedure, contribute to the development or improvement of waste management SOP. Although this is the very good model for the training, because we want to see the way that people practice on treating the waste in their own institute. And this is like we have to make sure that we just want to see the trend, the participant can implement and change the concept of treating the waste from they must do, but they have to create their own culture and do it properly. Yeah. Next, please. This is the roadmap for a biological waste disposal training program. For our Cambodia team, we are here in the green point that we will conduct the training in our own institute, and the date will be on 31st July this year. And under the supported from, we request the supported funding from RPHL Network, and we will train by next month. And for the next step, we will continue to conduct training to other site in country, because of our responsibility in our institute is not also provide the training, but we also provide the mentorship and also the mentor to other laboratory in Cambodia, and not only the national level, but we train every peer or lab in Cambodia. So we are willing to put our effort to distribute and to share the knowledge that we gain from our training, TOT training, and I hope we can produce the good result from that. Yeah, next, please. This is the reflection from our team. First is understanding the adult learning, is and second is facilitate the over teaching, and third respecting experience, and fourth is flexible and adaptive delivery, and fifth focusing on outcomes, and sixth is building a safe and engaging environment. And according to we have conducted the biological waste disposal training in Siem Reap, and we got a statistic from the evaluation from the participant. And at the time, we have divided to two cohort, like cohort A and cohort B. And you can see the satisfaction and the number of the participant. Cohort A, we got 13 participants, and cohort B, we got 10 participants, and the total of the participant is 33. So I will sum up it that the category for the positive feedback is like the training were very useful and knowledge gaining, appreciate for the opportunity, and for the recommendation from organizer, cost duration considered and more than 1 day is like a compact day that we have to put everything in 1 day. And we hope that more maybe we can expand the day like 1.5 day or 2 day for the training, and the material to be shared in slide PDF or reference and printed document. And sorry. Yeah, and the last one for the future request is more safety training and expanded cost. Yeah, and next please. We have some great photo from our training, and I think that's all for my presentation. Yeah.
All right, thank you very much, Sophia. Great results and great slides kind of presenting what your roadmap looks like to delivering the biological waste disposal trainings throughout Cambodia. So thank you for that. Do we have any questions from the online members? I'm not seeing anything in the chat, so please feel free to raise your hand or come off mute.
Renee, if I may,
Yes.
sorry,
Yes.
I didn't have the icon to raise hand. Take opportunity to have microphone with me. Okay, so I like to congratulate the Cambodia team, yeah, for the very good presentation, as well as the Malaysia team as well. So for the Cambodia team, I like to add that Sophia presented that he will have the training in their own institute. I like to add also that we had opportunity to add the training as a side event during the Mekong Institute Forum, which will be organizing in Phnom Penh at the end of July. In doing so, we aim to promote we are very proud of our subject matter of expert, and we like to promote the way that RPHL model of having peer-to-peer support. So I think during the Mekong Institute Forum or MI Forum, there will be quite numbers of participants. So they are thinking about 300 to 500 participants too. So it's going to be a showcase from this team, as well as to also, try to use their experience, their skill during this 1 or 2 days workshop. So we are planning to that. This is I like to add on. If I may go back to previous slide of Sophia, previous one. The learning outcome, can you go back to previous one? Learning outcome, learning outcomes. I like to hear more from Sophia, right? Whether we emphasize a lot on the technique, especially adult learning technique. So I like to get insight from Sophia whether how was it adult learning technique? Is that really help? It's very helpful for when you have your own teach back session, as well as during the workshop that you attend. Is that sufficient for the adult learning practicum session? So can you comment on that? This is for the second cohort. So Sophia, please.
Yes, thank you for your question. Actually, adult learning very useful for our experience for conducting the adult learning program to every kind of the training for based on my experiences, not only in the biological ways training for applying for adult learning program that we get the fruitful one result from the all participants that they enjoy the training. They can just like the open space for them to share their experience, and this is the way that we can gain and content many kind of experience and plus and get the benefit from each of the experience. Moreover, I also have implement the adult learning program in one workshop in Thailand as well, and it's very useful uh, for specifically in EQA workshop, and the all the participants really enjoy, and they get what we want to deliver the I mean the knowledge, the experience, and the objective of the training, and they gain so much from that technique. Yes, I think that's all for my answer. And maybe any add-on, maybe my team can add on that. Yeah.
Excellent. Thank you. Thank you. I very, very pleased to hear that not only the specific of this training, but you also apply for other as well, that you have chance to become the trainer. So thank you. That's very excellent to me. Thank you.
Yes, good morning, Dr. Jin. Can you hear me?
I can. So Renee, I think Smia would like to take up the floor. Renee, please.
Yes, absolutely. So welcome to SME. It's good to see you online, and any additional comments to share?
Uh, uh, Thank you. Sorry for today because I have uh, urgent machine, so it's like to join the Zoom. So I would like to add some of the space example for adult learning, because adult learning is important for us now, because the trainee or trainer we as adult, so we can share and use together to show that use the experience and something that they implement in their own lab or institute. We can share and show something that we can use to change and exchange together during the course. Okay, thank you.
Thank you. Thank you for adding that. Yes, I think you guys had a great slide that really spoke to the outcomes. And so I thank you for sharing that information. We do have another question in the chat for Dr. Kanchit from Thailand. So I'm wondering, perhaps Chintana, you might be able to answer this question as well, but what should be the appropriate number of safety officers in the national lab system? And that kind of helps plan for how many staff that need training. And I don't know if you guys have a benchmark. Perhaps Cambodia or Malaysia can kind of share how many staff per laboratory you have that you're working towards training as safety officers, and we could compare that to Thailand. But Jintana, I'm going to open the floor to you first, please.
Okay, I might not be the one to really. So his question is more of the number of the safety officer. So I think we can keep that to also get views from Dr. Pubet from Thailand as well. So I think it's vary from country to country, So Sophia, in case of Cambodia, safety officer in reality and in the ideal. So what would be the number? So.
Actually, this question is a little bit subjective for me because for the number we cannot specify it because based on the size of the lab and based on the specific of the lab that they are working for. If the lab, for example, in my institute, we have the National Reference Medical Laboratory, and in that we have another subunit, and each unit we have the safety member. And for the our normal, we have the team for biosafety, like 3 or 4 people who work on safety. But in the other hand, we take a look on the other lab that they have the small scope. We need only one safety officer, such as in charge lab or SORM, like simulative lab. They have only one safety to overlook on that. So to sum up for my answer is based on the scope of the lab.
But also take note that when we talking about the waste, medical waste management, not only Ministry of Public Health will be in charge. You will also have other ministry to get involved as well. So I think it's a good question, and to also have proper planning for ISO from Malaysia, also thinking about scaling up. Cambodia also thinking about scaling up. We need to be strategically on that, whether when we want to scaling up, so is it within or is the multi-sector, you know? So that's what we need to factor in as well. But very good question to articulate our thinking and planning. So thank you to Dr. Kanchit.
Thank you, Gentana. Thank you, Sophia. So we have one more subject matter expert to join us today. So I'd like to welcome Dr. Pubeth from the Thailand team to present on his unique training program that he was part of this past year.
Thank you, Renee, and Swadikap. Good morning and good evening for everyone. I'm Pubeth Yampan from National Institute of Health, Department of Medical Science, Thailand. Today, I would like to share on the showcase of the biological waste management initiative in Thailand. First of all, I would like to introduce our team first. The first one is Dr. Pawut Nungput. He is the veterinary officer, senior professional level from the Veterinarian Research and Development Center in the Upper Northern Region in Lampang Province, Thailand. He's from Department of Livestock Development. And the second one is Dr. Atisha Mahayotha. She is a medical technologist, senior professional level at Regional Medical Science Center 7 in Khon Kaen Province. This is in the northeastern of the Thailand. And my name is Pubeth Yampan. I'm medical scientist, senior professional level at National Institute of Health, Department of Medical Science. Next slide, please. First, we share on the workshop in Bangkok during 2 to 4 December. This workshop, we divided into 2 parts. The first one we learned on the waste management review. We was trained in the waste management and decontamination part. We can categorize the different types of the waste, explain the risk association, and know the step of the waste management process and select appropriate approach for each step. And another part is for the trainer development part. We learn on the review of the principle of learning and practice of brain-based training strategies and integrate with style and appropriate for the content, the curriculum goals, and the outcome, and strengthen adult learning skill and knowledge. And then we go to teach back in Siem Reap in Cambodia. So we teach for the participant from the hospital and the staff from in the Siem Reap and the other province nearby. Come to the conduct localized training in our institute. Because we come from the 3 different organizations, we have 3 workshops. The first one is the training on preparation for new auditors with combined checklist, ISO 1510, 35001 and PAT Act. This is the act in Thailand, and also include with the waste management on March and on 31st of March and April 1 April. This organized by Department of National Institute of Health, Department of Medical Science. And for the participant, we focus on the safety manager of each laboratory section at NIH. We have around 30 participants, and the topic is, the first one is introduction to ISO 15190 standard, and it's important and review the criteria and requirement of the standard, the technique for assessment in simulated situation, and we also include for the waste management in this workshop. This picture shows the activity in this workshop that they have every safety officer in each section have to review on the ISO 15190, and myself, I also teaching on the waste management in our institute, and also how to use the spill kit in case of they have an accident of the waste. Next slide. For the feedback of this workshop, they have the satisfaction summary. We compare between the before participating, the knowledge, the understanding of the staff before participating, and after the participating, and you can apply the knowledge to your work in your responsibility after the course. So overall, the most of certified was 86%. And next, please. For the next workshop, is organized by Veterinary Research and Development Center, Upper Northern Region in Lampang Province by Dr. Pawut. This held on April 29. The participant is the veterinarian from Diagnostic and Epidemiological Unit and also medical scientists involved in analytical and quality assurance process, and also lab assistant responsible for specimen handling and laboratory support, and technical support personnel involved in facility operation and waste logistics. So the total is around 32 participants is joined in this course, and the topic and activity in this course is like the introduction and the importance of infectious waste management, the definition and the type of infectious, the principle of the waste segregation, effective infectious waste management procedure, and safe collection, transport, and infectious waste, and also guideline for reducing contaminant before infectious waste disposal. And I will share, and me and Dr. Atisha will share on the regulation and law related infectious waste management in Thailand and the practice in Regional Medical Science Center. Please. This shows the activity at in Lampang Province in the north. The participant brainstorming and classify infectious waste of types, and then they have the group presentation during the activity for designing a waste management process with the participant process improvement, such as the different kind of the waste, the solid waste, the liquid waste. Next, please. So for the feedback of this training, they have 29 participants complete the feedback with the measure related to workshop as very satisfactory with score 4 or 5 on a 5-point scale. Is indicate the high level of satisfaction with the content and delivery and practice applicable of the training. And they have some comments such as clear explanation of waste category and legal responsibility. Practice session on segregation and transport was very helpful and would be useful to include the simulation or real case spill response for the next time. Come to the last event. This event is the topic is biosafety, biosecurity, and biological waste disposal. This held on May 28 to 30 May at the the hotel in Khon Kaen province, and also for Regional Medical Science Center 7 at Khon Kaen province. And the participant is from the medical laboratory staff from the local hospital in the region and nearby area. Total is around 40 participants. And the topic and activity is including all of the biosafety, biosecurity, and bio-waste disposal, such as the law and regulation related of biosafety and biosecurity in Thailand. We call Pathogen and Animal Toxin Act. And the principle, the biosafety level 2 biorisk management and AMP module for the waste management, decontamination, PPE, safety equipment, and the transportation of the infection substance. Next, please. So this shows the activity during this workshop, such as the PPE doffing and donning, and we also invited Dr. Pawut to join to share in the animal section health about how to treat the waste in his institute, and we also practice for the spill kit simulation. Please. So for the workshop outcome, the workshop yields several tangible outcomes that contribute to strengthening biosafety practice and operational consistency at our organization. The first one is improved understanding of the infectious waste classification and handling. So participants can demonstrate the greater confidence in identifying the different waste types, such as sharp, pathological, microbiological, and mixed waste, and selecting appropriate container storage and method and disposal route. The second one is enhanced awareness of risks associated with improper waste segregation and disposal. Through the interactive activity and group discussion, participants develop a clearer understanding of the health, environment, and legal consequences of the incorrect handle practice. The third one is stronger comprehensive of national regulation and real-world application. This training technical knowledge will legal framework, including relevant Ministry of Public Health and Department of Livestock Development regulation. Lessons learned from veterinary and public health sector were shared together for strengthening the One Health approach. And the last one is the increased readiness to support biosafety audit and internal assets. Participants were now better equipped to evaluate waste management procedure within their respective unit, identify non-conformities, and propose corrective action in alignment with the biosafety standard. So for the recommendation and the next step, to build up the progress achieved during this workshop and ensure long-term sustainable of the waste management improvement, we recommend for the action. As recommended, the first one is develop simulation-based training module, such as the in Lampang VRDC Lampang incorporation hands-on simulation exists for emergency scenarios such as the infectious material spill. This section should cover PPE, donning and doffing, containment procedure, decontamination, incident report, and post-exposure action simulated will enhance practice preparedness and complement theoretical training, and establish the standard waste handling SOP and visual tools, such as develop the implement clear, illustrate standard operating procedure tailored to the institute context. This should include checklists, color code container guide, signage template, and laminate flow diagram to promote consistency across the unit. And also should strengthen internal communication and coordination mechanism to promote regular meeting at the structure communication between biosafety officer, laboratory technician, janitor staff, and the administrative manager. Clear, slow, and designated point of contact will help to improve efficiency and accountable in daily waste management tasks. And the last one is to expand future training coverage to include environmental and chemical waste stream. The future workshop should integrate the management of hazardous chemicals such as formalin or xylene that used in the lab and environmental sensitive material, emphasize safe and handle neutralization and disposal procedure for mixed biological and chemical waste will enhance overall safety compliance. And this recommendation aim to transform the workshop knowledge into operational improvement and ensure alignment with the national biosafety goal and foster a culture of safety and responsible across the function of the organization. So this is all for the sharing from Thailand team. Thank you.
Thank you very much, Dr. Pubeth. A great variety of experiences from the Thailand team, spreading across Thailand and different institutes as they do their training. Each of the trainings bringing forth many participants and expanding beyond biological waste management into other biowaste management topics. And so congratulations on that. And I also concur with Dr. Kanchit and congratulations to all three of the teams. You know, definitely have taken the adult learning theory and taken that to heart and really become facilitators of the adult learning theory with the subject matter knowledge that you now have with waste management, disposal, and other topics. So congratulations to you all. Good lead-in topic here is the question on the table is, what is the next step? So will not only be a one-time event. And I've heard consistently the message from all three of our subject matter expert teams today that, you know, the trainings that they've already conducted are just the beginning of the roadmap of trainings for their institutions. And so I'm glad to hear that's the next step. But we need more than 10 trainers within the RPHL network. And so moving towards the second cohort, I think is a good next step. And training additional trainers, not only in the subject matter knowledge, but in the adult learning theory and how to be a good facilitator and trainer. So with that, I'm gonna turn the message over to Gintana and you know, what do we do for next steps with those who are on the line, Gintana?
Thank you very much. So what I like to go next is that is going to address also questions from Dr. Kanchit and maybe also from the RPHL network as well. But before I'm doing that, I like to add on the presentation from Dr. Pubeth that I had a chance to attend once, the latest one in Khon Kaen. And what I do like the most is on the practicum session. That's when they let everyone try to practice. And I really see that this is how adult will be learned, you know, will be learned, not only the theory. So very happy to see that, right, to see that. So congratulations to all of the three pioneer countries. We will see if we will have chance to have Lao PDR to share experience in the next platform if we have, yeah. So for the next step, I saw three of them mention about future training. So before I talk about RPHL network, I like to learn more whether in Malaysia case, also Malaysia case, Cambodia and Thailand, you mentioned about your future. So the question from you to all of you is that, you have any plan in mind? Is that something that already existing in your national strategic plan, or how are you going to do? So I like first to go for Malaysia and Cambodia and then Thailand to comment on that before I make announcement for the RPHL network. So if Malaysia will take up the floor, I saw that you want to scaling up the training. So the question is how? It doesn't matter whether in your institution or at the national level, it does matter, but we like to get your opinion on that. So Dr. Ilham, may I get your comment, please?
Yes, thank you, Ms. Jentana. Yes, we in Malaysia, actually in our long-term plan is to conduct training session regularly throughout the years. And the nearest plan is on this August 2025 in National Public Health Lab in Sungai Buloh, if I'm not mistaken, but to be confirmed later. So we aim of the all the participants throughout all the states in Malaysia, especially from public health labs and as well as hospitals. But this is the second training that to be conduct in our next plans. So the plan after this will be discussed further with my other team members.
Thank you very much. I also noted that Dr. Shriyama, who is also representing the national public health lab, also listening to your presentation, and I do hope that she will pick up. She will pick up. I'm sure that she also include in her national lab strategic plan.
Yes.
Now you have asset in your own country already. So
Yes.
thanks a lot for that. Let me get the comment from Cambodia. Sophia, you mentioned that, okay, scaling up is something that you are planning. So what would be something that you'd like to share your approach, to the other, how to scaling up?
Yeah, actually, in my own institute, we have the schedule for to do the refresher training annually. So this is goes into our I think should be the policies and the plan by the annual, and according to the role and responsibility of our institute, we also perform as the mentor and the trainer to provide the training to other lab in Cambodia. Is also the way that we can deliver the training and implement the technique of the disposal to like adult learning to other lab. This is the plan that we can do, and in short, maybe we will work with another department in Ministry of Health in Cambodia, like BMLS, to join for conducting the training for the whole country, because they are working specifically on biosafety for lab. But everything is depend on the fund. Yeah.
Thank you. But you already brand it to your existing program or activity
Yeah.
that you will do in your own country. Yeah, very good plan. Funding, we keep it aside. If our program is good, we will have funding. So let me hear from Dr. Pubet. I saw from his presentation, he mentioned about law, PAT Act. Dr. Pubet, is there anything related to the PAT Act that you need to train people under this for Thailand case?
Yes, for normally for PAT Act, we require for the staff for get the certificate every 2 or 3 years, as I remember. Yes, and next week or next 2 weeks, the Department of Medical Science will have the training about the biosafety for the BSL2 laboratories, and for the part of waste management is including in this curriculum. But from this activity, I think as a trainer, I get the how to teach back the training. I will use this training in this curriculum, that the participant will more understanding for the waste segregation and waste treatment. And another one, I would like, if possible, I mean, for the waste management, I'm in the area of the public health. If we can also including with the like animal section and also environmental section together, we work with the other department, so it would be better for the waste in our country. Yes.
Excellent. So thank you. So Dr. Pubet is the star, when we're talking about this training, so everyone thinking about him, and for Thailand, it's fortunate that they need to also follow the law as well, the law, the legal. So they need to train their people as well as he himself at the national level. So he has chance to see how can we integrate this curriculum in the national agenda. So these are the three different approach from the three countries. So to really tell us that the issue itself is very important, very important. But what we are doing or what we have done here is that produce a group of qualified trainer, not just early theory, but adult learning need to be applied. So that is our ultimate goal for that. Technical wise, they have, technical wise, they have. I always say that technical wise, they have that for all of the laboratory or the technician that we have. But the skill set is something that RPHL is looking for to build a qualified group of the subject matter of expert. So that is feedback from country, at least the three pioneer countries. I took note also many of other countries also joining this call as well. So I like to take this opportunity to inform you on the second cohort. So Goy, if I can have my slide, is very excited for RPHL to once again collaborate with DETRA and working closely with Eric and Rene from Sandia National Lab to come up with the second cohort. The second cohort. We already have the date, 18 to 22nd of August. So what we are going to take you to is not for you to see only the big city in Bangkok, but we would like to take the tour for you to have a look at the regional medical science center of the Thailand too. This time we are going to bring you to the northeastern Udon Thani. You may start to Google already, where is the Udon Thani? But I myself already inspect the site, and they have a really excellent facility. Not only you will have the very good training venue, but you also have a chance to have a look at the whole setting of the laboratory of at the regional level of Thailand too. And definitely the biomedical waste disposal is something that they are very excel, right? They very excel on that. So I think that will be something that Thailand would like to bring all of the participants to the second cohort of the biomedical waste disposal. We are going to have the same model, three phases, approach, training, in-person training, and teach back session, and then we also have you to try on your own country. So three phases model with the support from Rene and Eric, right? But what we like to emphasize this round is also the number of participants. We cannot accommodate a lot of people in the course. Because we want to maintain the quality, right? The quality. But we would like to, I like to pick up what recommended by Thailand. Dr. Pubet mentioned that we should have more of other disciplines joining us in the biomedical waste disposal, TOT. So having that in mind, so we would like to encourage the nomination from country to also think about put in the One Health lanes, put it in the One Health lanes. So think about your own setting, whether it's at animal health labs plays very important role, or is that environmental health, so you pick up on your own. So we would like to get the One Health a composition to come to this training. So you will be able to strengthen your own network, but also you have, you set up your joint team to tackle this issue once you return to your country. Once you return to your country. So the selection will be two stages. First of all, we encourage RPHL network member to nominate, to nominate. I will talk about it in a more detail during the video conference of the RPHL tomorrow, tomorrow. But this is just to let you know that we will have the nomination process by RPHL members. And then we aim that by the end of June, we should get your nomination already, right? And then after that, we used to apply the interview by RPHL Network Committee to ensure that you are competent. You also have the very the skill set that needed by this course, because this course is the training of trainer, so very intense. Also languages as well as your background as well. So we have the committee to select the right candidate, the right candidate. And we put it here is the experience, minimum of 5 years experience, but also we need to get the letter of intent from the candidate, whether what would be their willingness that they plan to do after the training, as well as we also want to make sure that once you complete this TOT, you will become the subject matter of expert of RPHL, meaning that any country would like to get support from you, they can request for the support from you. Regional-wise, if we need the speaker on this or the trainer on this, so you are willing to also participate as well. So this again is going to be very excited cohort for RPHL and Sandia National Laboratory definitely. And we I think screening the right participant is very important too, to get the right person, because we already have the right trainer, from Sandia National Lab, very qualified, very experienced. But from our end, we also need to get the right person as well. I also want to mention that for the trainee in the first cohort, those are presenting to you today, we also have chance to participate in the second cohort, but your role will be different. You will be co-facilitator this round. You will be assigned to teach in some session assigned by Eric and Rene too, right? So we invited you to join us as well. And that is the plan for RPHL network and upcoming one. Few more months from now. And the course itself, because it's 3 phases, it usually take about 4 to 5 months to complete. 4 to 5 months to complete. But when you complete it, I think certification will be granted definitely, Rene, for the one who complete the 3rd phases. So the 3rd phase are those who already try to teach in their own country. So we already have Malaysia, yes, Thailand also, yes. Pending Cambodia at the end of July, and then we complete the whole first cohort. This is my excited announcement, and I hope you like it. And more detail, I will, how many per country quota, I will talk more with the RPHL group tomorrow, right? Tomorrow, and funding arrangement, something like that, right? But definitely, Eric and Rene already booked for those period, and those period. And for them, also very excited too, I think, to go to outside of the Bangkok, not Bangkok anymore, not fancy hotel, but very unique, very charming city. I can put it in that way, right? So, any question, any final remarks, anything to add from all of the participants today? We have 2 minutes left, so
Hi, Dr. Turner.
I have Dr. Shrima. So Dr. Shrima, please.
Hi, sorry. I agree with you. So on behalf of Malaysia, I will discuss with Dr. Ilham. Actually, we were discussing just now behind the scenes. I will discuss, and then we will try and, like you said, incorporate it into the NLSP. Maybe into even our biosafety team, sort of to encourage and then expand it, because Dr. Ilham is very worried about the budget to do the courses. So I said we will figure this out together. I've already offered her the help. So then we will follow through with you.
Thank you very much. So that is excellent plan, Dr. Chirama. I hope when you said that talking behind the scene is not gossiping me, huh? No, huh? No. Yes. So for Malaysia and those countries that will conduct the training in English, and language is not the problem. You know, you may wish to consider, like for example, I'm ready to import Dr. Pubet to help you, right? So we have a group of the regional. You know, feel free if English is the language that you want to conduct, and it's a good opportunity for our subject matter of expert to exercise more, Dr. Sharma. So happy to discuss with you later, right? So. Thanks a lot for that. Thanks a lot for that. Any further remark from all of you? So if not, then I really like to thank the, of course, you know, Detra and Sandia National Laboratory to work side by side with us and to make the dream of RPHL will become true. Will become true. At least in this particular, in two subject matter of expert already that we work together. One is the biorisk management, right? We also get a very good group of our subject matter of expert, but this is the second one on the biomedical waste management. So I think from sincere, from all of us, from the team, it's very, gratitude to have you working side by side with us. And before I close the meeting, I also, Thanyapon, Goy also wants to hear from you the feedback. It's a short feedback, right, Goy? How many questions? Goy said 5 questions only. 5 questions only, and we would like to maintain our community based on your registration. So allow us to reach out to you when we have the next knowledge sharing like this. Yeah, the sharing like this will be organized every 2 months. I think right, every 2 months. And the next one will be in August. Yeah, the next one will be in August. Kindly stay tuned for the topic, and I'm sure that it's going to be very interesting topic as well. That we are going to bring speaker and expert to meet all of you. Yeah, to meet all of you. So survey, please. And during the survey, from all of you, I really like to acknowledge also the support and working hand in hand with all of my RPHL network members. This is something show that our solidarity and commitment that we are going to work together and making our regions as more of the well-prepared in any thing to come to our region, and we become the resilient region in detection of any diseases. With that, I like to call the meeting adjourned, and have a very good night to Eric and Renee. Looking forward to work with you very soon. And thank you to all of my beloved RPHL network members and participants to attend this session. Looking forward to see you very soon. For RPHL network members, see you tomorrow with a more detail of the announcement. So if I kindly request you to open your video camera once again to take a second snapshot to make this event more visible in many forums. So, all right. So, okay. I have Jalin as well from PNG. Jalin, I think you are listening quietly. I think tomorrow you will have many questions for me. So thanks a lot. Thanks a lot. We have Dr. Subai and everyone too. So, Sean also joining me. So thanks a lot. Thanks a lot. Hope you are getting better now. Getting better now. So, all right. 1, 2, 3. One snapshot for all of you. Smiling face. Thank you very much ขอบคุณนะคะ Looking forward to see you in any of RPHL Network events. So have a good day for all of you. Thank you and goodbye. Bye bye ค่ะ Bye bye ค่ะ
บ๊ายบาย
Bye bye ขอบคุณค่ะ